Welcome to the Homegrown Heart Podcast every Friday at 7 a.m. Mountain Standard Time with your host, Dr. Amanda Ryan, DO, MBA, interventional cardiologist, and an expert in her field. This week's topic, different kinds of stress testing. Please help me welcome our host, Dr. Amanda Ryan.
Good morning, Eddy County. This is Dr. Amanda Ryan, your friendly interventional cardiologist, and we are going to talk about stress tests today. Again, this is Heart Health Month, heart disease awareness. My goal and the goal of my team is to help make sure that we educate you, our patients, and the community at large about heart disease in any way that we can. We're passionate. Please follow our TikToks, our Instagrams, Lady Heart Doc for the #Life, our Advanced Heart and Vascular Center of New Mexico Facebook, my personal Facebook, Amanda Ryan. We're out there just getting as much information spread about heart disease awareness as possible. We had an amazing heart health luncheon yesterday where we heard some inspiring stories from women, some really intense cardiac disease that they have, and different procedures that they've been through. And again, I'm often in a position where treating end-stage disease is what I have to do because that's what's in front of me. People having acute heart attacks, having heart failure, their heart is weak. We're trying to do what we can to help their quality of life at that point, which is truly secondary prevention. Primary prevention is the idea that can we identify things before they become a problem? Again, I have a new medical student working with me this month. Amazing young woman, wants to become an OBGYN, has done tremendous work in the not-for-profit sector throughout the world already in her career. She's going to be an amazing physician, and she's done a lot of amazing things. So shout out to Alexis. And Alexis, I was talking to her this week about diabetes and that it is so prevalent in heart failure patients that we now classify heart failure as stage A, B, C, and D. If you are diabetic, we classify you as stage A heart failure. Regardless of any heart disease, any heart symptoms, whatever medications you're on. So that just tells you how significant that really is. If you have diabetes, you're already stage A heart failure. Meaning we need to get involved and try to prevent you from developing overt symptoms of heart failure and moving through the stages. That's going to come from diet, exercise, and sugar control in somebody with diabetes. So on the prevention side of things, again, we've talked about heart healthy parties. We've talked about echocardiograms and different kinds of ultrasounds people can get. We've talked about stress tests as well. But I kind of wanted a chance to really, again, quickly delve into the different types of stress tests, when any of them might be appropriate for you, and kind of how do we move through a progression of working somebody up for cardiac diseases. An EKG is the most basic test that we have. It's a $10 to $15 screening test. It's going to tell us a glimpse in time. It's going to pick up if someone's having an emergency heart attack. It's going to pick up rhythm problems such as atrial fibrillation or PVCs and PACs. Those are early beats. It's also going to pick up oftentimes if you've had a heart problem in the past. But it's not always significant enough, sensitive enough to really pick up blockages. So if your EKG is normal, that might mean you're not having a heart attack, although my cath lab staff will tell you that if someone's circumflex artery is occluded 100%, oftentimes they'll have a completely normal EKG. Now that can be scary. You're in the ER, you have chest pain, or you think you have terrible indigestion, you're vomiting, you're overall sweaty, and someone says, well, your EKG looks totally fine, and you're relieved. Thank goodness we have a lab test called a troponin 2. Now let's say we check a troponin. That troponin is somewhat elevated, then we're like, oh, maybe there is something going on. It is not from a heart standpoint. Not uncommon that we take that person to the cardiac catheterization lab and look at their vessels and they actually have 100% blockage that the EKG did not pick up. That's somewhat based on where the leads are located and where the different arteries in your heart are located, what each test can pick up. So let's say your EKG doesn't show anything that says, well, you need an emergent heart catheterization. So maybe your doctor says, you should probably get a stress test. What is a stress test? There are a lot of different kinds of stress tests. I'm going to, again, briefly go through them with us this morning. The simplest is a plain exercise stress test on a treadmill. You're going to get on a treadmill. We're going to get you up to peak exercise on a long-studied protocol called a Bruce protocol, and we're going to check your EKG while that's happening. We are looking for certain changes on that EKG or symptoms you might have or blood pressure issues that might come out as you get to peak exercise that could all suggest you have a significant heart issue. Simplest test. For people that can't exercise, or women that have large breasts, patients that we think, I don't think just a treadmill is going to give us enough information. And let's say these are about 80% sensitive of picking up heart stuff. But I will say, if you can get to peak exercise on a Bruce protocol treadmill stress test and have no EKG changes, your chances of having a significant cardiac event in the 5 years after that are very low. So now we've moved on to nuclear or echo stress testing. We're going to exercise on that same treadmill and watch the EKG if we can, as far as the exercise. Then we're either going to use an echocardiogram, which is an ultrasound, to look and see if all the walls of our heart are moving, or we're going to use nuclear imaging. The way a nuclear stress test works is you get pictures with a nuclear camera before. These are called rest pictures. It's going to cut the heart like a loaf of bread, I often describe to people. Look like this, look like this. We're going to get multiple views of the different walls of the heart. The heart's 3 major arteries, and most people perfuse different areas of that heart's pumping chamber called the left ventricle. Then we're going to see this on that nuclear stress test. If you've had a heart attack in the past with significant damage, your rest images will show that that area of your heart really doesn't get blood flow, doesn't conduct electricity well. But that's something we might have already known about, right? So we're going to get rest pictures. We're going to put you on a treadmill and get you up to peak exercise. Then, when you're at peak exercise, we're going to inject a small amount of nuclear tracer and have you walk 1 more minute. With that, then we're going to take follow-up pictures after we've had you eat a little bit and kind of try to get rid of the stomach uptake that can obscure our test results. You're going to come back and then you're going to get the second part of your nuclear stress test called the stress images. I tell people that whole process takes about 4 hours. Treadmill, you probably be on 7 to 10 minutes. Nuclear imaging, about 4 hours. So then with that, what we're trying to see is there a difference in the rest and the stress pictures, the before and the after. If one of your arteries has a significant more than 60-70% blockage, more tracer will be taken up by the other 2 arteries in your heart, and that'll have what we call a dropout in that section. I'll show a few pictures of that too. I'll have Danny, our producer, go ahead and put up a couple pictures of that so you guys get an idea of what this dropout really looks like. That implies you might have a blockage. By the way, it's great technology. It's probably about 90% sensitive and specific. Issue becomes if you have a blockage in all 3 major arteries, then it may not pick up any differences. You may have a normal stress test. I have a patient I just saw last week who's having a little bit of trouble again, who had bypass about 7 years ago. And I distinctly remember his stress test that we performed about 2 weeks before his open heart surgery that looked fine and normal. He was then, I'm going to call it about a month later, at home mowing his grass, and got this intense chest pain. It was very sweaty, exerting himself. It was very hot. He just got this intense pain. And he was sweaty. First, he thought maybe he was having heat stroke, but he went and sat down. He drank some water. He just did not feel good. He called 911 and got to the hospital just about as he collapsed, and he ended up having significant blockage in all 3 major vessels and had emergent open heart surgery within a few days. It's kind of scary because he had a normal stress test a few weeks before. But again, a stress test is non-invasive, good, but not 100%. And if you have blockages in all your arteries, it may not pick it up. Okay, so fast forward from that nuclear stress testing, and now we have nuclear PET imaging. This is fancy advanced technology that uses rubidium, a little bit different tracer, that is used in PET scans, as well as nuclear and CT, really combining multiple modalities in our radiology sector to give the kind of stress test results that are really close to an actual invasive angiogram. They are 99% accurate at predicting if you have a significant blockage. We actually have, it's a little bit newer technology. We have a third-party company called Cardioscan that's coming to our facility once a month to do these stress tests. And we'd love to have them more, but in the beginning, they were not on very many insurance plans. It is a very expensive test. It's very accurate, it's very expensive. So, but recently, we've been able to give them a lot of input at who our main employers in this area were, and they've really worked with them as far as their insurances go, and we have been able to make a little progress. We're now on regular Medicare, Blue Cross, Presbyterian, several United plans. So that's really increased the number of people in our area based on those insurances who really qualify for this latest, greatest stress test, which has been amazing. I cannot tell you the quality of the imaging. Often takes the breast artifact away. In our patients that are a little bit heavier, it's really giving us much better images than on a routine nuclear or echo or a plain EKG stress test can really tell us. Now for patients, and that special PET stress test does not involve any exercise, actually, it's all chemically done. For patients getting a routine nuclear stress test or echo imaging for a stress test that cannot exercise, we have medication that can stress their heart, that can make their heart's arteries dilate. The concept here is a heart's artery that does not have blockage, maybe it's this big, another one gets this big, this one takes up more tracer, and then we see a difference in the pictures. So for people that cannot exercise because of orthopedic or cardiac or other reasons, then they actually can have a chemical that stresses their heart. Now again, I think I've mentioned this before too, but gosh, every time I do discuss a stress test with people, I feel like everyone tells them their horror stories from getting a stress test and how horrible they felt or how they had a heart attack on the table or they collapsed and all these different things. And I fully believe that those things did happen, but I will tell you there's a couple issues. Number one, the medications and technology have advanced over the years. What used to make somebody extremely symptomatic, that was a chemical stress test, the patient would often be vomiting and would need reversal agents. The stuff would last for hours. Now maybe lasts for 5 minutes or less. Also, patient selection appropriate. If I have a patient that has a really good story with a lot of risk factors, I'm going to recommend that you go right to an angiogram. And what is that reason? Because again, if it walks like a duck and quacks like a duck, it's probably a duck. If you seem like you have heart disease and I think you have heart disease, I'm going to look with an invasive test where I can go ahead and fix you, quite possibly putting stents in your heart at that same procedure. Not go through several other tests to get to that then says, hey, I think you need an angiogram. Stress tests are for those medium risk, medium story kind of patients that you're like, could have heart stuff, but it could be GI or it could be other things. But let's go ahead and take a look. So that's the kind of patients you're really trying to do the stress test on. Also people that have very stressful jobs, the WIP and mine underground teams. the city workers, EMS and fire, those guys all do routine treadmill stress tests on a yearly basis to make sure that they can still handle pilots, a lot of different careers, that they can really handle those stressors. And can we pick up something in advance for people that are in vulnerable careers where them having an acute cardiac event not only affects their lives, but the lives of many people around them potentially as well. So these things are all kind of options. So again, moving to this PET stress testing with its 99% accuracy really has been a game changer in our practice. When we decide whether somebody should be put on a treadmill, get a nuclear stress test, get an echo stress test, get a PET stress test, or go right to an angiogram, we're thinking again about how high risk are you? I am not putting a patient that is super high risk for coronary disease in any position except to have an angiogram on a heart cath table, so we could really identify if you've got a blockage or not. So again, the safety of stress testing really comes into having trained staff, nuclear techs, rad techs, echo techs that really know what they're doing, that are well trained. Everyone should have ACLS certification. That's to know what to do if something does happen. You have physicians and nurse practitioners supervising the procedures, so if something does occur, they are immediately on site to assist the patient. And you also select the right patients so that people that are too high risk are not the patients that are getting these stress tests. So that's going to be a relatively brief session, but I really kind of wanted people to start wrapping their head around what are the different options for stress tests so that you know whether it's our office, whether it's another office, whether you just think, hey, I have been having a little bit of chest pressure or a lot of fatigue, or my sugars haven't been very well controlled, or my mom had a heart attack in her 60s and I'm 64, or I'm 54 and I'm going to be proactive. Every one of those people that I just described would be a great person to get a stress test. Get with your provider, get with a cardiologist, and really think, hey, is this appropriate for me? And could it make a difference in my future outcomes? February is an exciting month. I appreciate your attentiveness, and we will see you next week.